So we're at day three total knee replacement, and this is by far the toughest. Last night and today have been the toughest fight in this surgery for sure. And it should be getting better after tonight or tomorrow. So anyway, so I will show you some PT that I'm doing. We'll go from there. So I'm doing elevated hip thrust, no weight. Just activating the glutes, holding it, coming down. I'm gonna do 30 of those. And this helps with extension also on the knee. And I also have my stim going constantly, so it feels great on there. It actually helps relieve a little bit of pain. So the next thing I'm gonna do is I'm doing flexion and extension on my foot with a little tension. Just gonna pull, push down. I'm gonna get that connection from the end of my toe all the way up into my hip on my surgery side. So everything starts to just go in unison. So that's how we do that. I'll do 30 of these at my own pace. And then I'll show you, we'll move up to another exercise. So now we're just gonna get into some leg raises. And of course, my extension isn't 100% yet because it's so swollen in here. So just gonna focus on firing this quad up and lifting my heel. That way, we can try to get some strength built up. There's one. There's two. So I'm gonna do 10 of those. 3. I've been doing this twice a day. So I'll get 7 more done. Okay, so after I got those awful 10 reps done, which is tough, it's a tough one. I'll tell you what, my ACL surgeries that I've had are definitely harder than this. It's really hard, it's sort of difficult to describe though. There was more pain in the ACL surgery, but this is very, it feels very unique on how the pain and healing is happening within this area right here. When they just start cutting bone off and attaching metal pieces and plastic pieces to it, the joint itself inside has nothing to be inflamed about. Only that bone where it attaches to the metal is where the soft spot would be, and then all the surgical pain where they have to spread it all out and get to it. So what I'm feeling in joint pain is gone, which is so nice. So like when you do a leg lift, and an ACL tear, you feel it all the way down the center a lot more than you do on a total knee replacement. So what we'll do now is we'll just work on some flexion, which is gonna be sort of awful because I had really good flexion yesterday and the night before. Okay, I'm gonna go back down. My flexion I had all the way to 110 degrees the first night. It was maybe 5 hours after I woke up, but the swelling didn't kick in yet. So yesterday the swelling came in more, and I was online with my coach, and she said it looked great. And I had like maybe an 80, around an 80 degree. But today is much more swollen. My flexion isn't there. And I reported back to her, and she said, don't worry about it. Just focus on doing what I can instead of making it aggravated. And it will come because of the swelling. The swelling's more today than it has been this whole entire time. So we are on day 3. Day 3 is rough. And I gotta say, it beat me up a little bit. the pain comes in like a hurricane. It's sort of like you start feeling a little pain and it just waves in, and then after a little bit it'll come out once I start moving it and doing ice. Ice has been really good for pain relief for sure. But I've been doing red light therapy, I've been doing magnetic pulsar, stim, EMS. I'm gonna get my ultrasound out maybe tonight, and I'll ultrasound all along the sides, and that will help the healing process as well. So I'll be doing 10 of these to try to get my flexion back to a decent level. I do these twice a day. So as you can see, my flexion is really not cooperating today, but it's okay. We're still ahead of the game. I'm way ahead of where I should be as far as how I'm feeling. So on to the next one. Okay, so this last one I'm gonna do is, I got my box for box jumps right here. No, I'm not doing box jumps. Soon though, hopefully soon. I've got it up to the 30-inch mark, and I'm gonna sit on here and just let the surgical leg slowly just find its natural way down, and that will help with range of motion a lot. Now I can feel some pain in here right now, but it's not anything to be worried about. You see how it's just slowly, naturally going into place. So when I was pulling with the band, helped loosen it up a little bit. And then I like to end with this. These are some things that I do for ACL injuries as well. It's just, it feels very different. And many of the rehab that I've done on patients or on clients that had total knee replacement was about a month to 2 months after their surgery. So, but if you're thinking about knee replacement, don't be scared. It definitely is ranked 1 and 2, one of the most brutal orthopedic surgeries out there. I feel really good about this, and I know I'm going to come out the other side. I've got some goals that I want to hit, and we'll see what happens. But if you have any questions, reach out to me. This is day 3. Tomorrow, I'll probably be doing a couple things that you might have never seen before. Tomorrow or day 5, maybe day 6. We'll see how I'm feeling. So stay tuned, and we'll talk to you later.